So the first, I think the point where we have to start, or where I would start, is taking from Reich's own statement that orgonomy is beyond psychology. Right? And a lot of us have great difficulty with that, or tend to give lip service to it as a clever kind of statement of, well, it's not, he doesn't exactly mean that, because actually when you read Reich, there's a lot of psychology in his work. And that's not at all what Reich is addressing. In fact, what happened historically was that Reich, who certainly emerged as one of the major figures in forming modern dynamic psychology coming out of the 19th century into the early 20th century in the psychoanalytic movement, certainly understood what the nature and parameters of psychology were. However, what happened was that based on his research into the physiological and biological and neurological nature of psychological operations, he wound up and he found himself at a point where his own insights and research and data took him beyond, literally beyond psychology, into what the fundamental underpinnings of psychological experience are. Okay. Now, the reason I start with that is often there's a confusion, because today most psychiatric practice or most medical psychiatry would say something very similar to what I just said, which is that treatment and psychiatry is beyond psychology, and that psychology is beyond psychology. Psychology is no longer psychology, it's neuropsychology, it's biological psychology. And in a sense, this demonstrates great discomfort with primarily 19th century and early 20th century concepts of psychology, that psychology was somehow something that is of the mind as opposed to the body. The interesting thing, of course, from an orgonomic practice, or from the work of Reich, is from fairly early on, it was the understanding that psychology, unlike Freud's conception for Reich, from the beginning, psychology was very clearly a expression of internal or self-perception of natural biological and physiological functions and neurological function as it emerged. In fact, we know that that was true for Freud also, but Freud, for political reasons, chose not to emphasize that and chose to reject that and chose to punish any of his students who even proposed that that was a possibility, which, of course, historically led to Reich's being, along with other reasons, being pushed out of the movement. In fact, I feel that in many ways the reason, a somewhat controversial point, usually it's assumed that Reich was pushed out of the psychoanalytic movement or left the psychoanalytic movement because of personal differences and because of his emphasis on human sexuality as a central characteristic. In fact, what that really translates into is that Reich was pushed out or left, depending on which version you read, it's probably a little bit of both, because he pushed deeper and deeper into the biological function of the organism and the biological origins of human psychological experience, which was a tabooed area and a taboo position as far as Freud and the inner circle around Freud were concerned. That said, when we say that this is beyond psychology, we have to really examine the how and the why of that. Okay? And when we look in Reich's terms, this is not about a series of neurological hookups or neurological connections or the nature and function of neurotransmitters, although Reich himself would have been fascinated with that kind of data and seen it as very useful overall knowledge. But for Reich, what this meant is that the organism, or human organisms, or in a sense all living organisms, he tended to not be as overwhelmed with the uniqueness of the human organism as a biological reality, but that living matter functions biologically or functions in a particular identifiable course of behavior. And the fundamental and very simple reality of that really translates down to the fact that all living matter pulsates. Possibly in later derivations of that towards the end of his career, he moved towards the idea that all nature, including the cosmos, pulsates, but there's possibly, I'll be eventually bringing someone in. I'm beginning to line up a number of people to lecture on topics that are, a little bit beyond me in terms of the scope of my knowledge in these areas. But for Reich, finally, this meant that the whole universe basically pulsates. And by pulsation, Reich was very, very specific. And most of you have heard this before, when we've talked or presented. But pulsation is very simply an issue of expansion and contraction. I mean, if you read the contemporary literature in terms of astrophysics today, this is exactly, the big arguments about, and the controversies about whether it's an expanding universe or a contracting, whether you have the, expanding universe or contracting universe. The issue from an orgonomic perspective would simply be it's not one or the other. It's simply where you happen to come in on it. If you're in on an expansion, if you're in on the first 5 trillion years of expansion, that's where you are. If you're in on the next quadrillion years of contraction, the problem for us is that we have no way of we have a hard enough time dealing with expansion and contraction on a moment on a 5-minute basis. Okay. As opposed to most young children who can do it much, and babies particularly can do it much more, which again would lead to why Reich was particularly interested in young children, in that you could see, in addition to the fact that it was fun to be around them, but basically it was a place where you could actually see these functions in very unencumbered ways, usually. Okay. So that idea of pulsation, expansion and contraction, is central, and in one sense is the starting point and the ending point of this, this presentation, and of the whole issue of what therapy or orgone treatment is about. In one sense, what any orgonomist does, really, if they're doing what they're supposed to be doing, is attempt to establish the ability of an organism. And theoretically, it doesn't really have to be a human organism. It could be an animal, it could be a plant. And and in many cases, Reich and others did experimentations with plants to see about growth and enablement, and with one-celled organisms. But obviously, most of you didn't come here, to look into the issue of how you do therapy with plants. Although you might, But again, that was, I guess, more of a thing of the '60s. Everybody wanted to know if they could grow better plants. Okay. So the idea is that treatment involves working towards establishing, and here it gets tricky because of what our expectations are. Obviously, we all want, and we all come to this with some fantasy of we're going to go into treatment and our pulsatory, most of us, if we know anything about it, call our orgasm function, our orgastic potency will be established at full capacity, and we will walk out, in Reich's terms, a fully established genital character. In fact, for Reich, that option was very minimally expected. He was far less optimistic, I think, in a number of places, in interviews or in private writings. He said that there were probably only 1 or 2 people he ever encountered that were capable of that, or that he was ever able to bring to that state. One of them being his last wife, and he said he didn't do that. She just happened to arrive, and he realized that she was sort of that kind of person, that was Aurora. So she was so smart and so healthy that when the whole thing died over, she just disappeared. She left it all. She left it all to everybody else and stopped being involved with any of the politics or issues around this, and has continued to this day not to talk to anybody involved in this on any active level. She was actually in contact pretty regularly with Dr. Rothenberg and to some extent with Dr. Sobey, just on a personal basis, out of personal affection, not on any political or business level. But so that being the case, the issue is what does orgone therapy do, and how does it work towards establishing normal function? I think the first thing to understand about what we mean by normal function, then again, is not while we can, as therapists or possibly even as patients, have in mind an idea of ideal end goal of genital, capability, genital health, genital character structure, meaning a fully orgastic, a fully operative organism, that should be understood very clearly as a goal. And it's very important to have that goal, not because you're necessarily expecting to become that in some finite, fixed moment in time and place, although I think most of us fantasize at some level that that's really, even though people like Dr. Lewis, Dr. Sober, everyone say, well, you can't expect that basically we all know that it's really possible, and it's, that's just the necessary public, disavowal so that you're not held responsible. But in fact, I think we all secretly believe that there is some magic, direction that brings us there. But for the therapist, certainly, for the orgonomist, for the individual, following this clinical practice, I think and this I'll go back to Dr. Sobey, who I think was very articulate on this matter, that it's what makes orgonomy unique, in that it has a specific goal in mind. And so for the practitioner, when you're doing the work, the idea is not just the idea of trying to help an individual do better, to facilitate their overall life experiences on a daily basis, how they get through the day, all of which is fine. I mean, there's nothing, and there's no reason why we can't address those things, or we can't hope for those things. But for the practitioner, that isn't the goal. The practitioner keeps very, very focused on the fact that really all we're doing is through various kinds of techniques. We'll talk more about what's possible in terms of technique a little bit further on. But that all we're doing really is attempting to facilitate the organism's ability to tolerate, fuller expansion, and to work through and benefit from and not panic from in various ways active and real contractions. Because one of the first problems that organisms who are damaged, or we might say neurotic, or certainly psychotic, but we won't address psychosis, although it's really not, it's just part of the continuum. But patients who are ill or suffering from distress have a problem in their ability to handle the pulsation. It would be easy to fall into the illusion that the problem is an inability to handle the expansion. It's been my experience that the vast majority of individuals can handle expansions, although some can't. I mean, that's not, it would be dangerous to assume that this is a blanket statement. But in general, helping individuals enjoy or tolerate expansions to some degree is usually more available than helping individuals get to a point where they can handle the contractions that set in. So the basic fundamental functioning principle here is that for every expansion, there is an opposite but equal contraction. Now, if one gets to a point where you can expand more effectively, the tendency, of course, when you're in a period of expansion is, oh, this is great, this is going to go on forever, I don't want this to end. And when it does, usually most of us, especially neurotics, tend to go into a panic. In psychotics, they go into a complete disintegration, depending on how severe their structural problems are. So what one is looking for is really not, one of the great errors often made in orgonomic treatment, or in quotes Reichian treatments, is people go in with their own, as therapists, with their own mistaken ideas about the value. This particularly came out of the 60s response to Reich's work, that expansion was good. I mean obviously everything was that, you take drugs, anything that heightens the expansion is good, but anything that allows for contraction is bad, and therefore as soon as you go into a contraction, our solution has been now, which is what we're dealing with clinically now, is to hit it with something that gets rid of the contractions. So you heighten the expansions, but as soon as there's any downside to it, hit it with a medication, or if you're self-medicating, you hit it with a drug of choice, or alcohol, or whatever, or an indulgent compulsive behavior, whether it's eating, drinking, compulsive sexual activity, it doesn't, compulsive nose picking, it doesn't real. Sobey always used to say, it really doesn't matter what you choose. You could be picking your toes. It's really what you do to the individual simply, falls into or finds something that works for them, and that. But the problem, downside of that becomes often a fixed behavior that can be very difficult to get an individual to give up. So, in fact, what we're after and what we're trying to do, ideally, is get the individual to be able to pulsate as freely as their organism can tolerate. And then that's important to say, as freely as their organism can tolerate, because when we see individuals, they're usually pretty far along. All of us, most individuals come into treatment. Sometimes we see children, but overall, certainly in most, active, in-depth therapeutic situations, we're dealing with young adults to adults, or even in some cases to older adults. By that point, we have literally years and years and years of some chronic problem in the nature of this pulsation, so that the goal might be to remove that and to free up the organism to the point where it can operate close to ideally. But the reality might be that the organism simply doesn't have the capacity for more than a partial achievement of that kind of freedom or freeing of the organism, to the point that in some organisms you have to be very, very aware that to free the organism excessively or in an extreme would be to put the organism. You might get they might go. In other words, they might go out with a great deal of pleasure, but they will not. The organism itself structurally would not be able to tolerate that degree of pulsatory action. Who makes that decision? How you make that decision requires a great deal of serious consideration and study. That's why one cannot do this work without being trained fully and actively and ongoingly, because those are in contrary to when I was doing my training in psychoanalysis before I started working directly with Dr. Sobey, although I was still under his tutelage. In psychoanalytic training, the response is always, well, look, you're not going to do that much. I mean, you got to be serious, but you don't have to worry too much. The individual can. It's not a life and death situation in most cases, unless you're dealing with someone who's suicidal. In orgonomy, the position is we're dealing with dynamite, and that when you begin to open the organism up, you must be fully aware of what the organism is capable of and what you're dealing with. And it's always better to err in the direction of being less, or less grandiose than more grandiose. Doing less and accomplishing it effectively is better than doing more, despite the fact that any patient, of course, wants the whole enchilada, so to speak. Okay. Case in point, since I had also decided in this presentation to give some case presentation, but using my own experience, one of the first time, in about the first year or so, when I was actively beginning to do character analytic orgone therapy under Dr. Sobey's tutelage and direction, I had a patient who came in suffering from severe depression, severe clinical depression. She'd been on medication, which had moderate effect, kept her from committing suicide, but she was really pretty debilitated, almost to the point where she couldn't get out of bed. Actually, she came to her sessions mainly because a friend pretty much dragged her. She wasn't under any great economic pressure in terms of having to work, so there wasn't, that even pushing her. Okay? Worked with her for about 6 months with great effect. I mean, by the end of that time, she was working. She had gone out and gotten a job. She was, beginning to socialize. She had been divorced, which is one of the specific things that triggered her initial onset of the clinical condition. And she was doing quite well enough to come in and tell me that, she was quite happy. And she felt the therapy had been very successful, and that was it. Of course, I panicked, and I thought, well, we were just getting to the point where we could start.
Was she still using the drug? Had she stopped taking?
No, she wasn't on drugs anymore. She had basically given up hope on drugs. Drugs hadn't done much for her. That's why she was only she wasn't someone who knew anything about orgonomy. She was someone had said, look, why don't you see this guy? He has some techniques, they might help you. And she was sort of willing to try anything. And I remember being very but she was adamant, and I wound up actually getting into a bit of a pressured argument with her about how she wasn't ready to leave, and that she, and trying to coerce her. I mean, I didn't think of it as coercing. I thought of it as, well, here's my goals, and she's here. Why isn't she here? And why is she, what's going on? And when I presented to Sobi, he said, well, what are you talking about? Those are your goals, but she's reached a point where she's functioning better, and he pointed out that in any traditional therapeutic situation, this would be written up as a 6-month and very successful treatment of an individual suffering from severe depression who is now back and operating without medication. The problem, of course, was, had to do with the fact that I only had 2 patients, and this was half of my income. Walking out the door, Sobi was always brought it right down to the point, which was true. And we don't like to think of it in those terms, but. Dr. Sobi was always very sanguine in saying that, look, when you have people waiting online, you don't argue with your patients about when they. And in fact, you shouldn't argue with them even if you have only 1 patient. But it's harder to be that pure and ideal when you're looking at whatever income one has. Which is why Reich, in fact, felt that nobody should make money from. No one should work as a practitioner. The problem is that it should be funded by some institute that pays people who do the therapy, not, and that the individuals who are in treatment should be paying, but not the person who's treating them. They should be paying the foundation or wherever, and the salaries for the people who do the work should come in some way from that. I agree, but we don't have that. Okay, so. The point being that the fact that we have a set of goals or ideals, we should never lose sight of the fact that the patient always knows more about what they want and what they're capable of and what they need. And that can be a wide range of things. That can be from someone who comes in for 6 weeks, gets what they need, and is ready to leave, to someone who stays in treatment for various reasons, as I have patients who have been in treatment for 40 years, or patients who stay in treatment their whole life. I have one patient who comes in for what she calls her tune-up about once every 6 months. She's an old patient who actually knew Dr. Reich. Will give me a call and say, it's time for a tune-up, and she'll come in for 2-3 weeks of sessions, and she's doing okay. She wants the contact. It helps her keep herself, moving and active and oriented, and that's okay too. So there's a wide range of possibilities in this. None of this is about some idealized condition of who you are as the practitioner and who you are as the therapist and what therapy has to do mechanically. Okay? And that's, I think, crucial. So when we approach it that way, then the next question is what treatment is and what it is not. What it is, in the simplest sense, is a particular set of procedures all focused on reestablishing optimal motility in the organism. To the extent that I already said that what you want to do is basically find ways of optimizing the organism's ability to expand and contract, to pulsate effectively in the world and realistically in the world. Then, the obvious question that you or anyone else would reasonably have is, what are those techniques? The simplest way to start is by quoting Reich through Sobi to me, of saying, Was that the Abbott and Costello, from this guy to this, from first base to second base.
Who's on first?
Yeah, who's on? But there was the famous triple play combination in the Dart.
Tickers to Evers to Chance.
Yeah, right. See, you have to have. You're my kind of thing. Right. So that kind
That's
of.
my final answer.
Okay, that's your final answer. You just won $1 million.
Right.
Now you didn't say it right. My daughter would say, "Is that your final answer?" Final answer. Anyway, you all assume you all know what popular they were talking about. If you just thank you. So, given what it is, right, that stated, what Reich would always say is, it is the techniques and procedures and approaches towards doing this can really be anything. And he would say that, look, if a patient came in and I hit him on the head with a hammer, and they walked out feeling incredibly better and their pulsatory organism was functioning better, they not only would be glad to pay for it, they'd come back for another bang on the head anytime they felt restricted. That in a sense, one of the dangers in doing any kind of practice is for things to become rigidified. Case in point, the so-called 45 or 50-minute hour in psychoanalytic therapy. We know historically the reason for that was simply because Freud could not tolerate listening to anybody for more than about 45 minutes. He just became totally, bored, fell asleep. And the other reason he sat behind them is that he couldn't stand having continual face-to-face contact. So he basically figured out, well, if I sit back here and after about 45 minutes, say, okay, it's time to stop, that worked for him, and the patients it worked, and that was never written by Freud or anyone else as a rule of how you do psychoanalysis until students of Freud's or people and many of the students who had been in treatment with him said, oh, that's how the professor does it, so that's how we do it, to the point where today it's considered a sacrosanct, absolute, central part of doing psychoanalysis. So much so that there were big controversies when agencies began to cut back to 45 minutes as opposed to 50 minutes, and whether you violated this by half a minute or two. It sounds. We also smile at this, but these become big issues. And the fact is, I tell my patients this. It's always interesting. Reich never adhered to that. And all the descriptions of the way Reich worked, you came in, he talked a little bit with you, often about the weather or whatever else was going on. He made contact, basically was doing his exam. And then he did whatever he wanted to do, and then he said, okay, see you next week. That was it. Often sessions were no more than 10 minutes, sometimes 20, sometimes they were 2 hours, depending on whether he felt that was what he had to do. And there was no discussion of, well, I paid for my hour, but, there was none of that. And of course, as Sobey always said, well, that was right. He could get away with it. Nobody was going to question him. Or they did, he didn't care because he had people lining up. Okay, so, but nonetheless, the reality of that is that this is one of the few areas, psychotherapies are one of the few areas where we tend to feel that this is a fixed and absolute, condition of the therapy, and it isn't. So that when one really steps beyond this and realizes that what you're really talking about is anything, the reason a lot of people get frustrated, even people who are studying with me, in terms of practice, with the idea that you can't tell them that you do this and you do that and this will get it working, because in fact there is no such fixed ideal. What is fixed is that we understand certain things help and facilitate this process of expansion and contraction. Okay? So that's not to misunderstand. This doesn't mean that there are no techniques. It just means that no technique is a sacrosanct, absolute, dogmatic necessity. So, for instance, one of the most fundamental issues is our understanding that the respiration is directly related to this process of expansion and contraction. That's sort of a no-brainer. Obviously, if you're not breathing, your organism, if you're dead, your organism is not pulsating. Okay, so that precludes any possibility Okay? So obviously, the more one can establish a freeing of the respiratory function, which is, in fact, through observation, one of the most fundamental areas that organisms that in some way are inhibited or afraid or contracted or chronically contracted, express this kind of inhibition, is to reduce and restrain respiratory function. It's a fundamental biological animal behavior, so that you get obviously when a cat or a dog or any animal is threatened or in a threatened position, what's the first thing they do? They hunch up, they tighten up, and they restrict their breathing. The hissing of the cat is not an expansive act. It is an expulsion of the air and a tightening of the body, as well as a warning, a threat. But basically, cats, until the threat removes, will continue to hiss, which means they keep their bodies at a restricted respiratory state, and the body becomes more highly, poised. Okay, when the threat is removed, the animal simply, the body comes down, along with return to normal respiratory function. That kind of simple observation, which often is forgotten, that Reich was one of the first people to clinically identify that as a crucial issue. Although interestingly, when one reads Freud was very descriptive of the fact that patients in high states of agitation or anxiety had restricted respiration. And in fact, what is often not known is that Freud actually was one of the first people to use direct physical manipulation of the body to enhance respiratory relaxation and therefore greater flow of ideas and psychological impulse. One of the original forms of practice before they went to free association was the use of pressure on the head and the cervical insertion, Freud felt that had potential benefits. So the fact is that respiration is a crucial element in this. The great error in most people who present themselves as Reichians or pick up on some of this is the immediate assumption that respiration, breathing, or certain particular kinds of breathing techniques are what orgonomy is. That's not it. Breathing techniques are what living organisms are. I mean, you live, you breathe. You breathe, you live. Orgonomy, and what one does when one is an orgone therapist is hopefully learn techniques to enhance, improve, and optimize that kind of natural respiratory function. The purpose of which is not to improve breathing, the purpose of which is that we know that as breathing and as the organism can tolerate fuller and more natural respiration, the organism becomes more functionally alive, more functionally modal, and more functionally engaged. And that's really the purpose of orgonomy. Okay? These techniques that we might use, again, are at the service of establishing greater motility in the organism, greater tolerance for expansion and contraction in terms of ongoing pulsation. What it also is an attempt to help the individual function as a fully unified somatic and psychological or behavioral organism. Again, coming back to a fundamental principle of treatment, which is that the mind and body, or rather the body, soma, and the psyche are functionally identical. It's another one of those catchphrases that most people who approach this kind of work tend to take, as very quickly without looking at it. Reich was very specific about that. What that meant, and what that means, is that we are not and this is again what we mean by beyond psychology. We are not psychological organisms. We do not exist because of our psychological experience. That might be the way we monitor and respond to our existence, but that we are fundamentally somatic organisms. We are somatic systems, of which one of the systems within our somatic entity is a psyche, is a psychological organizing function, which in simpler terms is a perceptual function, a way that we organize, perceive, and process the ability, the experience of being somatically alive, expressively alive, and that it is not psyche and soma. It is really a total organism that has a psychic and a somatic function, both of which are expressions of the same organism. It's just a question, again, where you come in. If you come in psychologically, and Reich was always very clear about this, he said, you can get to the totality of the organism from analyzing and working in from psychological and behavioral function. So much so that even to the end, one of the last things Reich said to a number of the orgonomists at a meeting was that you can get the orgasm function, you can get to orgastic potency or to genital function through psychoanalysis. It's just going to take you many, many more years, if you do it right. So that there is no, again, addressing the issue of technique, there is no absolute technique. People are astounded, for instance, that a number of the doctors who were closest, the orgonomists who were closest to Reich, worked quite differently than Reich. For instance, Theodor Wolff, Reich's very close associate, who was considered by many to be one of the great practitioners of orgonomy, never worked on anything except the eyes. And he never got near the patient. He sat across a desk and watched them on a couch, and he would have them do particular things and work and make comment. Does it work? People who were in treatment with him said he worked wonders. So maybe he had. Again, the problem with this is always it varies, since the techniques aren't as important as specifically the ability of the practitioner to follow and to be in touch with the issues that the patient is working with. Okay, so again, the other major kinds of mistakes around that is to assume that once the organism, the other big misconception about orgonomy, to the extent that anyone knows what orgonomy is anymore, or Reich, is that that's the kind of therapy where people yell and scream and go into rages and cry and act out in various ways. Again, not what orgonomy is. That is one of the byproducts of attempting to open the organism and work through areas where the organism is restricted in terms of its effective pulsation, is that we're faced with the fact that as you do that, a wide range of possible emotions present themselves. Okay? And what the therapist has to do and what the patient has to do is work with the therapist to bring the organism to a point where it can work through those emotions to a point where they no longer restrict the functioning of the organism. Most of those emotions are in place primarily as a warning system or as a defense system against experiences and feelings that are directly linked to the pulsatory function, the expansions and contractions that have become threatening. So that historically what's happening for the organism is at some point as a young child, very young, sometimes as a baby, the restrictions placed on the organism are such that the organism attempts anything possible to rectify an insult to the organism. So theoretically, if one was restrained as a child, tied down, kept isolated in a room alone, and you began to look for ways to deal with that, to deal with the emotions that were coming up, you might choose a wide range. One would be rage, could be crying, could be sadness, could be whimpering, could be resignation, could be becoming very cute and very cuddly and very play. I mean, there's a whole anything that's available, is possible. Now, those are secondary responses. Those aren't primary responses. They're responses to the fact that the organism is scared, frightened, isolated, in need, and its needs are in some way not being met. So it does what any sensible organism has to do, which is it looks for any way it can to get what it needs. It doesn't sit around saying, well, gee, if I start doing this kind of behavior, when I'm 20, I'm going to have to be in therapy because I'm not going to be able to deal with If the organism chooses to go into a depressive mode in order to shut itself down because it can't tolerate the level of expansion, it doesn't sit back and say, "Oh, gee, I'm going to suffer from a long-term chronic, depression when I get older." Okay, it play out through any number of illnesses or categories of neurotic or even psychotic illnesses. I mean, we should never forget that even the most extreme psychotic, irrational psychotic behaviors are attempts at, addressing a threat to the organism, albeit it might not be as successful as other attempts, but never forget that every system for every individual that survives, the only failures are the systems that don't work and then the organism doesn't survive. So anyone who survived long enough, to some degree, the problem is that their defense systems have worked to some degree. Obviously, when they're coming into therapy, they haven't worked well enough for that individual to feel free and at ease. There's something disturbing them, but it's worked well enough for them to survive. So to just assume that you're going to say, well, this is an inefficient or a bad behavior, get rid of it, isn't going to usually, occasionally, sometimes if the behavior is not very deep, it simply is a matter of saying, well, don't do that anymore. But seldom do we encounter that. Not unheard of. But certainly in serious neurosis, serious pathology, it's not going to simply be abandoned because some knowing or apparently knowing individual says you have to abandon this behavior. So that's really where our work starts. What orgonomy or what treatment is not, while it is all the things I've said it is, what it is not, is a cure. And ironically, Reich was always extremely clear about that. I mean, most people could not be as clear as Reich was. If you read Reich, there are a huge number of open, direct statements that first of all, the treatment of adults, by the time the adult patient comes to us, they usually are so damaged that the hope for what we can affect is vastly limited by the circumstances of the long-term insult to the organism, which didn't mean that you don't do treatment and that you can't affect great gains, but you're not going to reverse a lifetime of physical limitation by simply having them breathe or simply through a short-term or period of intervention. Nor did he feel, as he began to address the more profound physical disturbances to the organism, as to distinguish from the behavioral and interpsychic emotional experiences, nor did he ever propose that he had discovered or had effected a cure for any of the physical conditions which he investigated and treated and explored. And again, made very, very clear. I mean, most practitioners and most companies that sell products for treatment would never declare as openly as he did. I mean, how much clearer can you say that everybody, when we're looking at the cancer, experiments, the experimental treatment of cancer, I mean, the opening statement is, everyone that we treated died of cancer. We did not effect a cure for cancer. Okay, so it is not a cure. It is a broad way of understanding function. We can look for great gains of function. We can look for, certainly we might be able to predict that if an individual is in pretty good shape to begin with, a short course of treatment might affect great gains to the point of something that approaches optimal normal functioning. I mean, again, it will vary widely depending on what the individual brings in terms of where they are and what they are. The same with issues of age, although Reich, I think, was less optimistic than I would be, and some of that had to do with the age that he worked in. For Reich, the general feeling was that once an individual was over, he said basically middle age, meaning about 45 or so, that he generally wasn't interested in he personally wasn't interested in taking them into active treatment. He didn't mean that he wouldn't refer them to other people, but he felt that what you could expect in an organism that was older, this is organisms that were older who were coming into treatment for the first time, okay? And particularly the elderly, he felt the limitations were so severe in terms of what you could affect, and that, in his view, if you were successful at opening the organism up fully, it probably could not tolerate, that kind of opening. So he was concerned that you might be successful in the treatment and the patient, it's like the operation was a success and the patient died, kind of thing. I'm more optimistic than that, and in my experience, more hopeful than that. I think also that was somewhat a condition of the time that Reich worked in terms of who the elderly were, who the middle-aged were, what the expectations for life after middle age were at the time that he was working. But in many instances, I find that every time I think I have exceeded or gone beyond Reich's initial insights, it turns out to be probably more correct than I had anticipated. But at least as I get into middle age, I become more optimistic as to what can be done. But okay, so it is not a cure, and it is not a way of thinking or behaving and it is not rooted in orgonomic psychology. In other words, it's not a philosophy of life. I mean, some people can make it that, come as what Dr. Rothenberg referred to as orgonomaniacs, people who live by the orgone, live by, the dogma of Reich. It's not, I mean, one can do that with any, system, but in terms of treatment, it is not, when I treat a patient, I have no interest in whether they become deeply committed to the practice or the ideas behind orgonomy, nor do I even feel that it's necessary for them to understand how orgonomy works or what it's about. Matter of fact, very often, patients who know the least about it, can often do the best because they're not able to, block their own experiences. But again, it's not that you shouldn't know anything about it, but it's certainly not a philosophical position. I would say this is true also, and this was a problem that all disciplines have had, just as one becomes interested in psychoanalysis, and certainly in the psychoanalytic community, or in the Ericksonian community, or in this community, that community, and in the whatever the discipline, and the ease of making it into a philosophy of life, an organizing approach to life becomes, the Gestalt groups. I mean, whatever one gets into can become sort of a way of shaping our lives. We're social organisms. We like groups. We like, social cohesion and these kind of things. And so it's understandable. But as a practice, as a treatment, the object is not for individuals to, nor do individuals have to accept, a Reichian or an orgonomic perspective on life to experience the benefits of treatment. No more so than one would have to accept the benefits of dentistry to get or some philosophy of how a dentist views the world, to accept the fact that if you fill a cavity, it gets, usually gets better if it's a good dentist. Okay. A lot of people have trouble with that because the implication is that somehow this should be a way of defining the way we live in the world. But in fundamental practice, if one is successful in treatment and one becomes healthier and one becomes more capable of what we would call self-regulation, the ability to just, expand and contract, to pulsate as fully as you can, and then operate from that, or as, I like to say, become a nice person, in a sense, that one goes out into the world and operates nicely. You don't go out into the world, from my perspective, and say, I'm going to operate, orgonomically today. I mean, as some people do. There are people, just as if one becomes a true Christian, one doesn't go out. I mean, the right way to be a true Christian is not to go out into the world and say, now I'm going to be a good Christian. You just go out in the world and do. I mean, the fundamental image that shapes me for that was Reich's image of The Murder of Christ. It's one of the most beautiful sections in which when he explains the difference between Christ and the disciples. Right? So, if none of you know, you should read this. I mean, actually, in many ways, The Murder of Christ is one of the more beautiful books. It's sometimes assumed to be a religious tract or mystical. It's not at all. It's just an incredibly beautiful piece of literature with great insight into fundamental literary texts of our world. But if you haven't read it, he describes at one point what the significance of Christ in the garden just before Judas betrays him, and at one point in the Bible, Christ is sitting with the disciples, and it's a beautiful day, and he gets up and decides, Christ decides to take a walk through a beautiful spring day meadow, right? And so he describes in quite detail of and then he gets up to take a walk just because he feels like taking a walk. It's a beautiful day. He walks through the meadow, right? And has this wonderful experience in the meadow, and then the disciples all get up to take a walk too. Because they don't get up because it's a beautiful day. They get up because Christ has decided to get up to take a walk. So they all have to get up to follow Christ, And then he goes through, literally, it's very wonderful and somewhat humorous. He goes through each of the disciples. I couldn't repeat them all, but he goes through each of the disciples and describes how each disciple walks. Right? And he said, well, this guy walks this way. He wants to be sure he looks like a disciple. This one has to, act as if he really knows why Christ is walking that way. And this one walks because he wants to make sure he looks better than this one walking, and on through. It's almost like, I guess I do it more like a Mel Brooks kind of routine, but it has that quality. I guess I responded to it. But the poignant point is that what then Reich says is at the end, if you were to look through the meadow, what you would see is the trail of 12 disciples, but Christ's footprints wouldn't be there. Why? Because he simply walked through the meadow. He wasn't weighted down. Now, it's clearly philosophical, it's clearly poetic, but I think it makes the point is that the organism doesn't become Christian. When one becomes Christian or orgonomic or psychoanalytic or Marxist or this or that, one becomes weighted down with all the ideas of how we are to be this way. When one begins to become a healthier pulsatory organism, one simply, engages life fully. If you can cite, whether it's because you read Marx, you read Christian writings, or you read Reich, or you read whoever, and that helps you, that's great. For me, in addition to Reich, it was also William Carlos Williams. I mean, there was a number of other writers who spoke genuinely to me and gave me some sense of connection to the world. Okay, so I mean, it really it has that quality. Matter of fact, I mentioned William Carlos Williams, which I think is another good sort of anecdotal confirmation of this. Williams, who was a doctor, a family practice, basically a baby doctor. At one point, a real ideologue named Kenneth Burke, who was a whole other story, but real ideologue, who was very, very angry and one of the people who actively, aggressively went after Reich and tried to discredit Reich, came up with the bright idea of sending Reich's work to Williams, who was a doctor and therefore could make a statement about how absurd Reich's work was. So it was wonderful. After years of reading Williams, I came across an autobiographical note in which he had received these books, particularly The Function of the Orgasm, and Williams sat down and read it, and he wrote back to Burke saying, gee, this guy makes a lot of sense, and I'm surprised I never heard of him before. He said, I don't really have time to pursue it, but if I were a younger guy, I would probably go and try to study with him. End of argument, and that was simply, the kind of thing. Williams didn't become an orgonomist or anything. He just simply said, it makes sense to me, And why did it make sense to him? Not because he was orgonomically trained. It made sense to him because he was obviously, based on everything else you read by the man, was in touch with life functions. And that's ultimately what the goal of treatment is. Okay? So how does treatment work? This becomes problematical only in the sense that, again, I'll start with an anecdote. When Reich decided that, under pressure from the younger orgonomist people studying with him, that they needed to have a training seminar. Prior to the establishment of what was a short-lived training seminar, training was basically done pretty much in the old way of you were assigned to a senior practitioner who supervised you, directed you when you consulted with, and occasionally you had case conferences with Reich if there were problems that nobody else could really fully address. But there was no formal training group as such. They had meetings around conferences around issues in orgonomy. But so under pressure from all the growing number of practitioners, Reich established a training seminar with Reich, right? And with case presentations and demonstration. And about the fourth, after the fourth meeting, Dr. Sobey came into a session with Reich, a therapy session with Reich, and Reich said to him, initially, "So how do you like the seminars? How are they going?" So I was like, "Oh, fantastic." I can't tell you, when I'm now working with my patients, it's so much better. I sit there and I say, okay, this is the way Dr. Reich would do it. And now I'm really doing it like Dr. Reich would do it. And Reich sat there and listened and then turned around and said, okay, the seminar is over. We were not meeting him. So we went into panic. What have I done? Well, he said, not you. He said, you're about the fourth or fifth guy who's come in here and told me that you're all becoming little Reichs and you're all doing it the way Reich does it. Right? And he said, that's completely contrary to the nature of this work, or to working as a doctor. You have to do it and find it. You have to use the principles and find your own way. Right? So, in a sense, that is the problem we're up against, which is while there are fundamental principles and fundamental approaches towards working with patients, it is such a variable process that we can understand the basic principles that we have to focus on. What the specific techniques are much, much harder to categorize and catalog. There have been attempts at doing this. People like Ellsworth Baker, whose Man in the Trap gives you, here's a problem, this is what you do. The problem with that is it doesn't always work that way. What do you do when it doesn't work that way? Okay? So again, generally, okay, when a patient comes in, the issues are how we're going to proceed. And often patients want to know, how long-term is this? Okay? The answer there is obviously variable. Again, as I said, there are patients who I will see for a few weeks. Usually, in general, as a rule of thumb, we say treatment should last, an initial course of treatment should certainly be 12 weeks to establish whether we can really accomplish, any major effect. The patient and the therapist will know that pretty much within roughly a 12-week period. That given, how long the active treatment could be can vary. In some patients, you're looking at 6 months, and that should be enough to affect major alterations. In some patients, 6 months is what is necessary to make major gains, and then it can go on for years in terms of things and supports and maintenance, and that there is a difference between active therapy, clearly, in terms of aggressive active treatment of specific chronic conditions, and that long-term maintenance for patients who need continued care or need continued contact or need periodic, re-entry or re-engagement based on life situation. Because the other thing that goes on is that this is not a steady state thing. It's not something you get to a certain condition or a certain place and life stands still. Obviously one ages, one grows, circumstances in one's life continue, so it can vary. But depending on who and what and how you're treating, the patient comes in will determine largely length of treatment and circumstances of treatment. Some patients come in and require, being seen 3 times a week. for 3-4 months. Other patients once a week, and then suddenly at a crisis point in treatment, they might be coming in twice, 3 times a week. Some patients, move effectively along, and after a while, coming in once every month, and varying. Okay? So none of that is written in stone, and it varies, and therefore it's very, very hard to tell anyone interested in treatment what the specific course of treatment will be. Although clearly within the first 3 to 4 months, it should be pretty clear what we're dealing with, not just what I'm dealing with or what the practitioner is dealing with, but what the patient and the practitioner are dealing with. Okay. That said, then again, we want to look at issues of what kind of treatment, what treatment is like and what one can expect. Well, I'm not going to give very, very elaborate case presentations, which I don't think would be appropriate in this kind of setting. Just to give you some examples. One, and then we'll go to questions and answers, I think, relevantly. Generally speaking, some of the conditions which are most immediately responsive, and I mean very dramatically responsive, are somaticized conditions that are deeply related to behavioral and emotional blocks. For instance, orgonomy gets some of its most dramatic effect with people who are suffering from migraines, people who are suffering from asthma, people who are suffering from what in the parlance of contemporary medicine would be somatic conditions that have a very, very aggressive and active emotional and behavioral component, environmental component. This is not my assertion. This is, anecdotally as well as the data on this from years and years of my own practice and collecting comparable accounts from a wide range of people doing this work for many years, going back before I practiced, to people like Dr. Sobey, Dr. Handelman, just in general, most orgonomists will clearly document and offer numerous examples of patients who came in suffering from migraines and within a matter of a few sessions never had migraines. And I can give my example. A patient came in who's been migraine-free now. She's out in California, married, having a baby, but came in, had suffered from chronic migraines, young woman, as long as she can remember, into her adolescence. After 1 or 2 sessions, broke through, cried for about 2 or 3 days, nonstop, and enough that she had to be on the phone with me regularly, like, why can't I stop crying? Why can't I stop crying? And then never had a migraine again. Now, is that a miracle cure? She thinks it was. I keep telling her, it wasn't such a miracle cure. Didn't mean she never had a headache again. It's not, but she never had a classic migraine. Now, that kind of... Okay,
I'll change tapes.
Okay. So he has the famous, he said, he was asked by Carl Reiner, in his guise as the 2,000-year-old man, do you believe in this loving the baby, being nice to babies? He says, sure. He said, you should be very nice to babies. They're wonderful. You should, matter of fact, even before they're babies, when they're in the womb, we should yell into them, hello in there, whoever you are, we love you. We're waiting for you. Okay. So it's not just organ. See, obviously he's orgonomic. Okay. So migraines, asthma. Most patients who I've treated over the years who have suffered from asthmatic, chronic asthma gain major, major benefit. The problem with chronic asthma is that we don't have a hospital situation or a control situation. With migraines, it's a little easier because patients can be in and out of the use of medications. They're not as controlled. With asthma, of course, it's very hard to ask a patient to give up completely their medical treatment, since sometimes their life can depend on that. But in general, to patients who have been in treatment, they almost invariably begin to get to a point where they're asthma-free or can function with very, very low use of any kind of chronically in what we call status asthmaticus, meaning going into the hospital, having trachs done, and having really, life, support, crucial care, critical care, who have not had that for years and years and years. So by relative standards, great deal of success. Now, none of this, if one understands the kinds of things I've been talking about today, is shocking to anyone doing this kind of work, because basically what these conditions like migraines, asthma, these other deeply physical expressions of organismic contraction are essentially that. They are particular somatic expressions of profound and severe contraction depending on the individual's overall condition. So it would not be at all surprising, based on the underlying principles of orgonomic treatment, that these conditions would respond very, very quickly and appropriately, I think, to treatment. Depression does very, very well. Again, it's not a simple, easy kind of treatment there. You're now entering a larger and broader field of circumstance, both situationally as well, and it's less contained, tends to be more systemic, more pervasive. The advantage of things like migraines and asthma from the organism's point of view is that they are very, very narrow kinds of conditions, not that they're not frightening or problematic or pervasive in some ways, but they are local, they are basically bounded and binded. They bind the organism's energy in a particular area. Anxiety depression tends to be much, much more pervasive, therefore much more problematic in terms of how one gets at it, roots it, respond. Also, the conditions optimally for treatment of depression are problematic, and since we've had the development of fairly effective anti-depressants and anti-anxiety drugs, it makes it even more problematic to carry through an active treatment of depression without medication. It's very hard to say to a patient, look, if you're feeling so debilitated that you can't function, that you shouldn't use an antidepressant that's available. In the old days, where you saw more, it's the same with treatment of psychotics. It's very, very hard. Many of us would not be willing, under the present circumstances, to take someone who's schizophrenic and say, let's go off all your medications and go for an active treatment. However, in the old days, when you didn't have much of this available to you, and you could, the records we have both from Reich and other ergonomists who undertook treatment of patients who were suffering from profound, long-term chronic depression, anxiety depression, as we usually see it, and or other psychotic range of disorders. The success rate was great, although albeit very, very arduous, very, very time-consuming. The appeal of medications and pills is that they operate with relative speed and with some degree of efficiency. The problem is, as most patients who have been on antidepressants know, that after the initial 3 months of stabilization and feeling more optimally functional, which is not to belittle that at all, the more chronic issues of the depressive personality, depressive structure, begin to operate again in terms of restricting one's motility, one's engagement in life. So in other words, you're functioning better, but not necessarily enjoying it more. And these become initially you enjoy it more, because initially it's better than anything else that's been going on prior to that. But then the deeper issues set in. And very often what I will see is individuals who come into treatment who have been on long-term use of antidepressants because they want not only to get off, but also to get to the deeper, more pervasive issues which the antidepressants haven't resolved. And that's a very, very common presentation. And there I think we offer some hope, some degree of success, some degree of optimism about that. Albeit it's not a magical procedure. Okay. So the general course of treatment and techniques, I mean, by now most people know that we work on a couch. We work with the body in some degree of being disrobed, depending on the comfort and privacy, issues of privacy for the patient, feelings of security. Most patients, once they feel more secure, will basically be able to open visibly their body to the practitioner, so that we can work directly on the way the body characteristically guards against expansion, guards against a normal pulsation, in terms of the armoring, the literal physical way that the body blocks particular sensations or the movement of energy. Basically, all organisms find characteristic ways, either behaviorally or physically, or in a sense, I wouldn't separate behavior and physical. I mean, the organism finds ways of characteristically, in various ways, shapes, and forms, of blocking the full experience of expansion and contraction, and compulsively resists that kind of motility and becomes more and more compulsively locked and fixed, or chronically locked and fixed. So what the therapist does is begin to work on, and we have a range of techniques that help, including a hammer when necessary on the head, but that only in special circumstance. But based on that, we will work always with the point of view of increasing the ability of the organism to tolerate expansion and to work through and to be able to also tolerate the contractions that come along, and to carry that out of the treatment room into daily life functions, both in terms of interpersonal relationships, business, life functions, family functions, and finally and ultimately in terms of the most intimate relationship, which is the sexual relationship, which is to maximize the ability of the organism to reach out lovingly, not to have sex, which is the problem with contemporary views of sexual revolution, sexual liberation, not to have sex, but as be able to reach out lovingly and establish a loving embrace, not as Dr. Sobel used to go into paroxysms of irritation when people say, "We made love." He said, "You make a table. You don't make love, you love." So the ability for the organism to love, whether that's rolling around with your kid on a bed, which of course today would be considered incestuous because it's pleasurable, or whether that's reaching out to your mate and embracing fully and genitally and releasing through that embrace into a full expansion and then relaxing into the natural diminishing of that and the natural contraction from that, without getting irritated and pushing the loved one away, to stay open, to stay in contact. These are the ideas and concepts that we hope the organism begins to take out and integrate into their lives. In fact, if any of us were able to do that naturally, we wouldn't be seeing a therapist. So the role in that sense of the therapy is to sort of get you back. I always keep coming. It's interesting. I don't know why, but we keep coming back to the dentist. The idea of a good dentist is someone that gets you back to the point where you can go and eat and chew without being terribly bothered. Without having to suffer from the fact of how nice it is to chew and eat. Okay. In some ways, it's no different. It's very functional. The goal is not, again, to become orgonomic. The goal is to become, a healthy or as healthy a functioning organism as you can. Nor does it give you a vaccination, whether you're using one of the accumulator devices or in treatment or been in treatment for a lot of years and are in a maintenance phase of treatment, whatever it is. None of this gives you a vaccination against illness or disease or death, despite what we all like to think. And I still have some old patients of Dr. Sobel who get word back to me periodically that they couldn't go back into orgonomy because they can't believe in orgonomy anymore. And that's the key, is the belief system, because Dr. Sobel died of cancer. So therefore, orgonomy must be wrong. So again, the last comment that we make on that is one of the grossest errors that we make about any kind of practice, any kind of treatment, or what we make about health, is that health is somehow equivalent to or demonstrated by longevity. So that if you live to be 90 years old, you're somehow healthier than someone who dies at 60. Not true. Someone who dies at 60 could be infinitely healthier than someone who lives in chronic misery until they're 90 or 100. Health is not a condition of longevity. Longevity simply means by hook or by crook you've managed to live that many years. Some of the healthiest individuals I've known died young. Sometimes the reason for death has to do with because you've done more, you've engaged more, you've taken more risks and paid a price, potentially, maybe not. So again, if I had to then sum up, the nature of orgone treatment is a functional approach towards what the optimal overall ability of the organism to pulsate and to operate effectively in its natural environment is. So we can stop now, and I'll take any questions or address any issues, or you can make any statements you'd like to make.
So say, when you read Reich's later writings, he does draw that line where he says, we're not concerned with perfectionism in here. There is no perfect in nature.
Right.
And I think maybe he stated that later in the work because more and more people were looking for that perfect.
Well, because they were beginning there was greater and greater mystification, and actually towards the end, he really wanted to dissolve the whole movement, because he was very suspicious of movements, and understand that Reich himself had very, very ambivalent ideas about individuals becoming career orgonomists or building, orgonomic careers. I mean, he understood the necessity of having trained practitioners, but his final view was to create a broad-based application of this in which you were training teachers with some insight into orgonomic principles, orgonomic understanding, training social workers. Actually, he felt, contrary to what some people have sort of deified the idea of the medical doctor, he was very, very disturbed that medical orgonomy, or that psychiatric orgonomy, not so much medical orgonomy, but in the true sense, but psychiatric orgonomy was beginning to be identified with what orgonomy was, and that in his final views was the hope that social work, in the true sense of social work, not agency social work, but that orgonomy would begin to become a pervasive social work practice, involving all, in Reich's terms, all the real issues of social work, dealing from medicine to teaching to education to child rearing to any kind of life function, and that the doctors, and that in the final last attempt at creating an approach towards this was to create what he called teams, clinical teams that involve social workers, teachers, and medical psychiatrists, as well as doctors, to work together around issues of child rearing and family and interpersonal relationships. By that time, everything got, basically blown apart, so we don't know what the final outcome of those kinds of more pervasive approaches. Although, interestingly, when one looks at contemporary ideas, much of this has become current in some way, or incorporated into ideas of how you do prevention, how you deal with high risk, how you deal with family practice, family, interventions, how you deal with couples, how much of Reich's fundamental insights and fundamental insights that we call ergonomy have been largely, dispersed into general consciousness, whether they're applied in quite the difference often is that what gets cut away or cut off is the idea of orgastic potency, orgastic or pulsation and orgonomic pulsation, which coming back full circle to what I was saying, without that, then there's no anchor to the living organism, so that a change in the political climate is a change in the program. One of the things that happens in education is every time you get a really good educational system, in place or a good educational approach in place, there's a political climate change, and therefore you never get to see whether it was ever going to really work. I mean, one of the classics would be, for instance, Head Start programs. You know, I always like to use this with my students at the new school. Head Start programs work. We got like almost 40 years of data that they really work, right? That, of course, politically, they're constantly targeted as failures, as a waste of money. But the fact is, again, they work because they address broad-based, changes. But they're also the first systems to go, the first systems to be cut. All sorts of things. And then the other problem is you can develop the greatest. One of my I gave a lecture on. He did one of the topics on this about liberal education. One of the great things that I've begun to see is that many of the principles of respecting children, liberal education, views of setting up interactive child-centered treatment, child-centered education are great, except until they get in the hands of the people who have to administer to them and teach them, and teachers who can't really tolerate that kind of. And that's not any different. We have examples in Orgonomy. I mean, the one of the major schools that was developed in the United States based on A.S. Neal's and Reich's ideas, the 15th Street School, was a disaster. And it was a disaster not because the ideas were fundamentally wrong. It was a disaster because the individuals who were administering the school were functionally incapable of dealing with those ideas in a healthy way. So again, and this is no different in Orgonomy. One of the biggest problems with Orgonomy, such as it is today, and it becomes smaller and smaller as a practice, as clear as an area of interest, is the individuals who practice it. There's a lot of infighting, a lot of narrow, parochial concerns, and no willingness to tolerate dialogue or engagement. A few of us who try this are basically ignored. And this is not just an Orgonomy, but it does also. Orgonomy doesn't give you a vaccination against those kind of things. So I think Reich had some understanding of that. Just quickly, always to remember Reich's probably favorite joke. We don't often think of Reich as a guy who liked jokes. He did. Is the one. The argument is whether it was Reich's joke or A.S. Neal's joke. They fought over who and according to the documents, it was Reich who told the joke, wrote the joke, and sent it to Neal. In fact, they both were wrong. Obviously, Reich heard it from someone who got it. I finally traced it down. It's an old Sufi anecdote, but this is the one where the devil, Satan is in his domain, and one of the little assistant devils comes running down from Earth and says, Master, there's been a disaster on Earth. He said, oh really? What is it? He said, they've discovered the truth. Satan sits back and says, no problem, we'll just send someone up there to organize it. And Reich really, I think Reich it was very clear that Reich really understood that was more than just a joke, that was a profoundly real, humorous insight into what happens, and how, the Rockefellers, the powers that be understand that in some fundamental way.
Picking up on your issues around education, are there any people in the city now who are working against the kind of anti-sex, anti-pleasure, view of adolescence? I'm thinking, there's such a policing now of, and for some good reasons, a lot of abuse and a lot of sexual harassment of girls, but it's really gone the other way. And I'm thinking of people who actually work with kids in schools.
It's almost impossible. You know better than I.
Well, I'm trying to get a network in the city.
It's impossible because the few people who would be willing to even address that are so afraid of being publicly, exposed to that, and the kinds of reaction. I can remember being at meetings where I've heard so-called experts on sexual abuse of children, declare that any parent who rolls around in bed with their child and experiences pleasure is engaging in sexual abuse. And these were like leading experts in the field, and so you have to sit. Now, I mean, I will talk out against that and would argue with them, but there's also I've had instances where I've argued with people like this and have been accused of being, so to some extent, most responsible people, to some extent, unless it's vital, you sort of pull back and realize that. But the only other thing to keep in mind, these things tend to go in cycles, so there are opportunities. But also the danger is the assumption that what people with our tendencies towards a more, what I would consider rational view of infant and child sexuality, mistake is that by giving adolescents or young children the chance to explore their sexual lives or to have an open forum, some of the worst stuff about sexuality that I've ever encountered is from adolescents talking about what's reasonable kinds of sexual behaviors. It's not because it can't be romantic to assume that these kids are healthy. So there is some reason to moderate these positions. I think liberals have a tendency to get in there and say, well, let's let kids do this and it's going to be healthy. The best curative, I think, was Reich's point, is that you always have to remember that if you're going to open it up, right, there can be numbers of generations of innocent victims, people who suffer greatly. Now that's nice to say in a conference, but when it's you who is losing a job or being sent to jail because you befriended a child or because you've fallen in love with it, because you're a teacher who's fallen in love with a 16-year-old and is now going to be, I remember Dr. Sobey once had a patient who was beginning to have an affair or was on the verge of having an affair, and he was an adult, and he was in his 20s, with a 15-year-old, very mature 15-year-old, who was pursuing him, and he was a friend of the family. And so in discussing with Sobey, what Sobey told me, which was exactly the right approach, that the guy has to go to the parents and say, I'm falling in love, and I'm actively interested in pursuing a serious relationship with your daughter. Do we have your permission? So when I told this to the guy, he said, well, I don't really want that kind of, I'm not that serious. I said, well, then you can't have the relationship. So again, there are ways to approach this reasonably, but the liberal would say, how could you stand in the way of true love? What was it true love? Was it responsible? So again, Reich, who gets blasted for being a pornographer, for being all this stuff, was much, much more conservative than the liberal kind of view of, teenagers have a right to this. On the other hand, the kind of social reactions, we've all been seeing this kid who sued recently, because he went in pre-adolescent, who ran a rhyme on a girl for being flat-chested or something like that, got suspended from school. And the mother rightfully, up in Larchmont, of course, it's a little bit easy to hire a lawyer, in the Larchmont School District, let him back in. They sued. They expelled him from class for saying something like some rhyme that said the girl had a flat chest and she was, whatever. Which is obviously pretty obnoxious. But on the other hand, they had an interview with the mother, which was absolutely online. She said, I grew up with 4 brothers. She said, those guys would have never been allowed near a school if they were held accountable for the things that they said to me and everybody else. And the issue is where are you going to draw the lines? Obviously, if the kid were doing something, aggressively hostile, you step in. But this is the problem with educators and the fear. I've seen teenagers, I've seen pre-adolescents who were brought to me because their parents were terrified because the school wanted them on heavy-duty medications because they were, acting out or saying things or doing things in class that the school considered disruptive. And it's very clear the kid was not that disruptive. They were bored, they were this or that. But without someone like myself coming and intervening and saying, this child doesn't need to be on serious anti-psychiatric, psychoactive drugs, the school would have insisted on it. Why? Because it makes the child more manageable.
Well, it's something like Neil certainly said, is that kid hates structured school. That's a pretty clear indication of health.
Rationally. Look, my daughter will say, And I remember Dr. Schwarz's daughter, who's now in college, and was a really good student. She's really bright. My daughter said the same thing. You asked my daughter, does she like school? She said about 3 or 4 hours of school during the day. She doesn't mean just recess. She likes that too, but she likes there's certain things she likes. And she said, if I could come and hang out and do those things, but I didn't have to do these things. And she doesn't mean just the things that she has trouble. There's something she has trouble with that she does want to go to because she's interested in them and she knows, but she's not getting the choice. What she objects to is the fact, why do I have to do these things that I really don't like, that I don't really want to do? So what you do is you sit down and say, well, because.
Getting back to therapy, what?
I don't think, by the way, that we've gotten away from that. I think these,
Okay.
that's my particular thing.
Getting back to therapy, well, how would you describe the orgasm arc in a therapeutic context? What does that refer to?
The orgasm arc, you mean the orgasm function? I don't know the term, the orgasm arc.
ARC?
Yeah, but
It seems to me,
I mean, if one is referring to the ability of the natural function goes through an arc-like process of basic, again, expansion and contraction. But in terms of the orgasm function, a functioning organism will express its energetic function of expansion and contraction through tumescence and detumescence, or in more specific terms, going from a state of relaxation or ease to a state of tension and charge. So the standard presentation of that, is going from what I like to call the I. I'll erase this before. Although this is a film center, they'll like this. To a state of tension, right? To a charge, to a state of acme, high peak, to a state of discharge, right? Of tension, to a state again of relaxation, right? Now that's the orgasm function. Right?
you don't recall the phrase orgasm arc?
Maybe I've seen it. It's not something that Reich uses, or that particularly, but the arc, in a sense, is now in treatment. The thing that's often missed when one looks at this, and possibly this is what you're referring to, is that this is not a static condition. That this is a infinitely repeating process, meaning it only stops with the cessation of that particular organism's ability to go through, whether it's a one-celled organism or a multi-celled organism. All living organisms go through a similar kind of life cycle or arc in which the ability to experience this also peaks at a certain point and diminishes over a life process. So we could call that an arc. I don't know of a specific technical term. It's possible. I can't believe that I've missed.
Is there a term for when you are lying and your head is back and your pelvis is coming up?
Yeah, I've never heard. I don't remember even reading and calling that the arc. That is certainly when the organism is in a state of, we call it orgastic spasm or orgastic, pulsation. The body tends to undulate, and part of that is an arching. And if you're thinking, I guess maybe I remember seeing the term used, but it's not. But it's mainly in a healthy, functioning organism. It's not that much of a stiffening arch as much as an undulating sort of movement, which is ultimately towards the pelvis with a relatively free movement of the pelvis, very subtly. The most interesting misconception, and I remember talking with Dr. Sobi on this, he talked about this very often, is that the most common experience, and I've now done orgonomy long enough to experience this, an experience in my own life, is that people who come into Orgonomy view the idea of this as the ultimate, there's the big O. Everyone's going to have the orgasm. It's going to, stars are going to come, lights are going to go on, everything is going to, music is going to play.
Fireworks.
What?
Fireworks.
Fireworks. Okay. In reality, most people who finally experience anything approaching a fuller orgasmic experience usually come back and will often say, I know I did, gee, I felt wonderful afterwards, but it wasn't anything nothing like what I imagined it would be. It wasn't nearly as dramatic. And then Sophie Rose said, yeah, and he said that right point. It's not. It's not that one of the big attacks always on Reich and Orgone or Reich's views was that the old line that, well, if you listen to these guys, what it would become is, sex would become nothing more than having a drink, getting a drink of water when you're thirsty. So I always say is, yeah, right. That's a wonderful reality. When you really think about what it feels like to get a nice drink of good water when you're really thirsty. It's wonderful. Is it the end-all and be-all of life? No, but at that moment, it is an extremely wonderful experience. So in the same way, if the organism naturally, goes through this process, it's going to feel very, very good until the next time you have to go through the process. And if it's interfered with, think about how it is when you can't get a glass of water or a decent drink, and you're very thirsty. It's pretty irritating. Think about what it's like if you can't get to the bathroom when you have to get to the bathroom. These are all natural processes. They, in fact, don't trivialize it. What happens is the romance around this, the mysticism around this is what trivializes the whole event. Sex, in natural circumstances, sex is a particularly important aspect of human behavior, but it is not nearly as special as it is in our society, especially the bad, especially the good. We demonize it and romanticize it rather than live with it as a natural part of our functioning. Reich didn't do this,
but because it's disturbed, it becomes something
right.
People fixate on.
That's right. Because I had friends, and I worked very closely with a number of people who were involved with the Kalahari Bushman Project back in the 60s, and was involved in publishing some of the first articles that became a wonderful book if you want to get some insight into what life was like and sexual life was like in another world. A book called Nisa, N-I-S-A, The Life of a Kung Bushwoman by Marjorie
My heart is big for you.
Nisa, which is basic books, it's in paperback. It's a wonderful, wonderful book, and it's also a wonderful book for women's studies because it really shows just how different the lives of women are in non-patriarchal, women-centered societies. But one of the things that Mel Konner and his wife Marjorie, who I was very close friends with, did, for instance, one of the things they did at one of their trips was they brought copies of Playboy, some copies of Playboy to show Bushmen, and they showed them. And the Bushmen found these really wonderful. I mean, they thought it was the funniest things they'd ever seen. Well, they didn't find it sexual. It had nothing to do with it. They just thought it was funny that it was absolute proof about how weird and strange these people from, from wherever they were. Because why would anyone have to do that? What would be how could and you spend money for this? You seek these things, and you use, first of all, paper was, rare to begin with. So the whole idea of this, that people were interested in naked bodies, was really hilarious to them. Not out of contempt, just because they just simply had no way of understanding why, except for weirdness.
Yeah, it reminds me, I saw a comedian recently who said he doesn't understand strip clubs. He said it's like if you were sitting at a table and a turkey would be dancing around saying, oh, don't I look good? Would you love to have me with some mashed potatoes and gravy?
No, obviously, but as David is saying, the real issue is that it only becomes interesting because of what it's charged with. Again. Really, I think some of this, to the degree that I think things are getting better. Despite the fact that it looks right now much more pervasively worse, that I think eventually there will be definite improvements in overall adolescent and over. I mean, when I look at there's so much attention given to the to the tragedy and to the violence of kids' lives today in school, and the really sick stuff that goes on. But when I look at most of the kids that I see, adolescents around my daughter's age, or that most of them are pretty nice, and most of them have a lot more healthy views about interpersonal relationships than I did when I was a kid, and than most of the people I know did. Not that they don't have problems and issues and things, but even about sexuality. A lot of them are just not, they're not as hung up about it or as intimidated by it, nor are they being promiscuous in ways that kids, I see it sort of. There's going to be a long transitional phase in which there could be a lot of innocent victims, and when I say that, I certainly hope it's not my kid and anybody I know, and kids of anyone else. But that's a risk. I think of it very often as what happened. What we're going through now is a period similar to the arrival of Westerners, of the Western sailors on the Polynesian islands. For the Polynesians, it was like, when guests come, one shares oneself fully with them. So one has sexual contact. It's the best and nicest way to welcome and to make contact and to establish, connections. For the sailors arriving, it was one big whorehouse, and they treated these people not as loving, tender, interpersonal contacts, but as whores and as vehicles for their sadistic aggression, which basically destroyed those simpler societies. So I think to some extent, the real risk is the kids who I see around who are really pretty nice and pretty genuine and really struggling quite, productively with these kinds of issues, who are exposed to a lot of real sickness and to some extent don't have the kind of armoring that I grew up with and that most of the people I knew grew up with, which were basically that we could deal with, that kind of pathology because it was familiar to us, or in some way we played into it.
Your drawing of the it's not just sex. It should be clear. It's not just sex.
Yeah.
Right.
No, that again, the biggest mistake made orgonomically is that the goal is to achieve the orgasm function so that you can have good sex. But the goal is to achieve this orgastic function so that it operates systemically through your organism, whether it's in how you cook a meal, how you do a job. Again, love, work, and knowledge are the well springs of life. They should also govern life. Central premise of Reich's whole approach. And that is basically what that's about. The big mistake often in mechanistic views of orgonomic ideas is that this is about the big sexual moment. It's not. Similarly, very hard for most of us to accept that sometimes simply lying down with one's loved one, or mate, and just being physically close and sharing the pulsation of the bodies closely without a sexual union, or without a sexual act, or without a performance, can be as productive and as fulfilling of that function as an active, hard erection with deep, wild, passionate, throwing off of the clothes and et cetera, et cetera. It varies.
I think it's one has to realize that the same, the function of respiration, for example, just being able to breathe freely, being able to experience orgastic pleasure, being able to experience pleasure in work. You can't have one without the other.
Right. That's right.
They're all the same function.
That's right.
But I want to comment two things. One is on that. There is a book where Reich, I don't think he calls it an arc, but he draws diagrams
of the undulation,
of the orgasm, reflex, where there's an increase in excitation up to a certain point of no return and then release.
Right, it's a graph.
And then it's kind of a excitation
No,
plotted against time. And then he'll have, like in the case of the nymphomaniac, it does this, but never.
So that's consistent with this. But I think what you're talking about is in process, and I don't have the book. There are times when he talks about what it looks like in the body, and that there is this kind of arching at the from the lower back into
the movement, the anus and the mouth
moving
coming together.
But that's that's just descriptive of of the process. And I think he does use the word arc, but it's not something that I commonly use.
What?
I know I've seen it in other writers' books, more from mechanical sort of diagrams, and this is the orgasmic function. and
That's
this is-
That's Baker.
Right.
One other thing, I just want to say, maybe because we're videotaping for posterity, that for all the reasons you cited, it's very hard to pin down, what are the techniques of treatment, and Reich never wrote about them, really, etc. However, the uninitiated might not realize the decades of clinical work that Reich did and the excruciating detail in which he did lay a foundation.
No, I think that's a very, very
The
good.
armor and the segmental arrangement of armor and the way he developed over the course of time from character analysis to vegetotherapy to
And the other presentation that I usually do historically is to lay out exactly the stages in which Reich, developed various particular insights into how to carry out. And actually, I think that's a good curative to what I've approached it today. Is that right? There should not be an illusion that there aren't very clear, specific techniques to doing this treatment. And that certainly when one is trained in them, one is trained in very specific ways. It's not that. And it would be misleading to say that anything goes. Particularly, we understand the way the body is organized physically. We understand what we refer to as the segmental armor. We understand where and how we work on it. There are fundamental principles of how we work on it, and that you're always working down from the upper segments to the lower segments, basically approaching the pelvis. We know,
the kinds of emotions that
Right.
are bound
We know.
in parts of the
less,
body.
Less than we would. One of the most interesting things is the tendency, for instance, in Baker's approach was to say that a specific emotion is locked in a specific place. Reich was less willing to do that. Reich had hoped at some point, he said if he had had the time, to have a full-scale project in which you could do what he called an atlas of the physical system, the biophysical system, in which you could actually map and look and see where and how the organisms and the physiology work. He was not able to do that. He was also a little bit more, from everything I've gathered, a little bit more reticent to become that fixed and say specific emotion. But we do know.
But he talked about rage in the pelvis or
Yes, that's right.
neck.
The diaphragm holding against.
When you analyze the character, isn't that basically what you're doing?
To some extent, character becomes more pervasive, although there are clear references, there are clear indications that character behavior, right, as a defense system, has specific parallels in that certain particular types of character behaviors have specific references in the way the body also armors and protects, defends. So yes, there would be specific. But again, in Reich, you're going to be hard put to find that kind of absolute fixed. He'll also say, and then sometimes it doesn't work that way.
Well, because there's an infinite variety of
Right.
variation in the way it all works
To
together.
give you an example
have
from
right.
one of our seminars with Dr. Sullivan, we have a patient, right, who is always completely relaxed on the couch, right? And yet behaviorally, characterologically, he's very, very, but we have him breathe, his respiration's fine, the body is very relaxed, what's the problem? Where's the armory? The trick is that he has used relaxation as a way as a defense, so that he's actually not, he tends to open the organ, let go, right? And so what you had to do with this patient is get them to tighten up before you were going to see anything.
I think when I first started reading Reich, one of the most, it was a revelation when I read him say somewhere that people could use sex as a defense against experiencing pleasure in sex.
Right. That's right. And I guess what I was trying to offer as a, antidote to the standard, like, well, here's how you do it, but I think your caution is well taken, is that this is not a sort of hit or miss or sort of, Zen like, well, let's try this, maybe this will work. There are very, very specific techniques, which to some extent it's not appropriate for a general presentation, but certainly there are specific techniques, very clear set of conditions, clear set of understanding of the principles and how they work in the organism. That is available. That is clearly part of what treatment entails.
Does something happen in the therapeutic context that you would call the orgasm reflex?
Well, when the patient is capable of that, one will see during periods of extended respiration the ability of the pelvis to become free and loose and move. It's not nearly, some of the less experienced or more, I would say, more wrong-headed people involved in Reichian work or orgonomy will say that, yeah, see, you get the pelvis moving, and it's flexing, and there's the orgasm. That's not at all what it really looks like. I could take any patient I could take anyone off the street and get them and do a series of physical operations and get the pelvis to move quite freely, and they wouldn't be anywhere near. Matter of fact, that's one of the things. For instance, one of the great problems with someone like Lowen. I mean,
What
he
do we
has.
all think of that?
Yeah. Well, because he gets. I remember watching a TV show one point he was on. Coming into sober, he said, "I can't believe it. He got people out of the audience, and he had them lie on this round thing and do a couple of shouts and stuff, and said, yeah, don't you feel your pelvis now? Don't you feel sexual?" And they said, yeah, I feel wonderful. And they got up jumping, and and I said, what the hell is going on there? And he explained this was Lowen, and this was the kind of thing that you wanted to avoid. This is not the orgasm reflex. And as Solby pointed out very rightfully so, is that if he got someone out of the audience who was very, very fragile, and you did this to them, he'd have more than just someone jumping up and saying, "I feel great" on their hands. He'd have probably
It's like the primal scream therapy.
That's right. The same with the primal scream people. That was another big.
It goes against exactly what Reich so painstakingly tried to tell you should avoid, which is going to the more powerful layers before dealing with the more superficial layers.
And not trusting the patient. Always the patient knows better than you what they can tolerate. Now, there are times when you have to know how to push. Obviously that's part of what what a practitioner does. I mean, if the patient knows the whole course of treatment better than you, then there's no point for them to be there. But basically, you've got, it's not that the patient controls treatment, but as a therapist, you have to trust the patient to tell you what is going on for them and what they can tolerate in some way, not always in a clear and direct way. Just as you have to, that's what Neil meant and Reich meant when he said trust the child. It doesn't mean that everything the child tells you is clear and right, but if you intrinsically trust them and spend the time to find out what they're trying to tell you, it'll be there.
When Reich is describing the orgasm reflex too, he says it's something really beyond language in a
That's
sense.
right.
I mean, he couldn't himself. It was difficult for him to even articulate what these basic.
That's right.
Were.
That's right. That's why he was hoping, and why in the bioelectrical investigations, he went more in the direction of physiological description of changes in the body and descriptions of actual sensory and sensory, function and physiological readings, which make it more accessible. The personal experience of that, the best place to find that is in good poetry. Or good music. One of the things that Reich, as a person, loved was good. Was listening to deeply, and there he would say very clearly, great art. That's what it does. It in some way taps into the same kind of speechless and
All that Reich did just try to describe it many times very effectively. The Murder of Christ, the general character.
Right. No.
Or what's that quote? Find that way to the thing you feel when you raise your children, or do this or that or the other thing. It's.
But I think what Sanjay is getting at is that despite all the attempts at finding words, Reich was very. I asked Sophie about Reich's views on language, and intellect, and Reich felt that most intellectual activity, most language, was a block against feeling. And that's the problem. I mean, his hope eventually, when he discovered and started working with the doorbuster, that was for a while he acted himself. Now maybe I can go back into the treatment room. He had this idea that somehow he could just walk in, use this thing mechanically, and then walk out and have the patient deal with, only to discover that it wasn't in any way quite like that. So,
in your description of sort of healthy sexuality, it reminds me of what many women for generations have said in terms of this continuum of pleasure and sensuality, and just touching, being, as opposed to going directly to intercourse. So men often are socialized in a particular way in the sexist context, and women are socialized. Yet women also are often socialized to inhibition around more active, direct sexual behavior in a particular kind of way. So in this kind of therapeutic context, how would women be encouraged to develop that other sort of?
Well, I mean, in principle, there's no difference. I mean, to the extent that you can free the function effectively in any organism, they'll find out. I mean, it would be, I think, one of the things I like most about Reich is that he never presumes to tell anybody how and what good, healthy sex life is going to be like in terms of the way it plays out. I mean, he makes pronouncements about social aspects, the social things that stand in the way of it or prevent it. But basically, you'll know it when you have it, and you'll work it out. Obviously, how each individual does it would be considerably different, anyways. It wouldn't be mechanical. What it would be, obviously, is not prohibitive, not punished, not guilt-ridden, we could talk a lot about what it would not be, what specifically, how it would look in one person versus another person is much harder, I think, to
Do you
fix.
find in your practice women drawn to this theory as much as men?
I think so. But what they conceive of as a good, healthy love life might be somewhat different than men. Although I find that in general, as people go through treatment, it gets closer. Incomparable. But that doesn't mean that they don't have their specific. In general, women are softer than men, and whether that's we could get into really extended discussions as to whether that overall softness is socially organized or whether it's biological. My guess is that it's deeply biological. One looks at primate studies that males in nature tend to be harder, more armored, physically bulkier, more peripheral, more antisocial in the sense less at the center of social life. Women, females tend to be more softer, more nurturing, and so that we might be dealing with aspects of that within our overall structures. That said, doesn't mean that it can't be somehow come to a more functional unity. Okay. So I hope you enjoyed it. I hope it was useful. I hope you come to the next one. We'll let you probably be here, I guess.
Yeah, I think so.
Something.
Thank you.
Thanks a lot.